What's up, y'all? What's up? My bad. They all looking at me crazy. So, y'all, I done passed all my classes. I passed patho, I passed physical assessment, and I passed intro to nursing with straight A's. So, yay me. This video is going to be about how to pass patho. Sorry, I just woke up, took me a shower, dropped me on my shirt, a little dingy, and I just came to the park to, you know, this is my best way to study because when I be at home, I don't study for shit. So don't mind me. So today we is going to I'm gonna give y'all a disclaimer. I ain't finna sit here and give y'all no answers to no tests. I ain't finna give y'all no answers to no exam because one thing I ain't finna be doing is get kicked out of school for cheating. So, but I will put you in the right direction of where to go for patho. But one thing for certain, two things for sure. Baby, y'all are strangers to me. I'll be damned. I would be damned if I sit up here and fail class because of y'all. So I will be transparent though with my grade. So in a way, I did technically get an A, but it's considered a B in the program due to the fact that I got a 93 instead of a 94. A 94 is considered an A in nursing, but I got a 93, which is technically a B. So I am going to be transparent about that. And I will put on the screen too, like different modules. So this might be a long video, so y'all need to grab your popcorn, your chips, your dip, or whatever. I'm going to scoot over to the side a little bit so that way y'all can still see me in frame. Maybe I'll just put it on this side. So again, like, comment, subscribe, leave a post notification. If anybody you know that is going through this and needs assistance with patho or anything, y'all can hit me up in my DM at Keon813. So let's get into it. So again, I'm gonna put a disclaimer again. Listen, I am not giving you the answers to the exam. I will put you in a direction to do that, and I'll make separate videos on each system disorders and how it was easy for me, because I'm telling you, it was like over 1,000 disorders, and I'm just like screenshotting stuff. Like, it was over 1,000 disorders. I'm just exaggerating, and you have to know them all. Like, you have to know them all. Like, they was not playing when they say learn those diseases and disorders, because it's 50 questions and you can get tested by every single question. So I'm just letting you know that. Number 2, you have to read that book. I don't care what nobody say. I'm not reading that book. That's not how I pass. Everybody does stuff differently. I read the whole entire patho book. That 400-page book, and each chapter was like 50, 60 pages. I read it all. So another thing, if you stay ready, you ain't got to get ready. So I literally waited. Even a whole weeks and months before patho even started, I was already studying. So I was already ready for the first exam, even though I got a B, a high B, but I got a B on my exams, but I still passed. So I was way over the limit. All I needed was a 78 to pass the course, and I got a 90 something. So you getting advice from a real one. So I'm just letting you know that now, but you have to read that damn book. I don't care what nobody say. People always be saying, don't read the book. It's just too much time. It is. Don't get me wrong. It is too much time to be reading that patho book. But you might rather be safe than sorry. Because I'm telling you, when them diseases and disorders start kicking in, ain't no YouTube gonna save you. So I'm just giving y'all a disclaimer. And then, like I told y'all, I am not giving y'all no answers to no damn exam. But I will tell y'all the direction to go. And for that, we're gonna start with that. So let's talk about the exam. Each one, all right, so we had 3 exams. 2 of the exams were 50 questions, and the other one was 100. So I could kind of give you the direction of what our exams was, but it might be different from your program. And I heard some programs, they don't even take patho. So let's get started. My first exam was considered on, let me make sure, cancer, immunity, the skin, musculoskeletal disorders, and senses. Those are 5 big chapters. In each of the 5 chapters, each of those, that's like alone 250 pages of just those alone. Out of all those chapters, I feel like the main 2 you need to focus on, like the main, like as in confusing, is cancer and immunity. When I tell y'all, the other ones, like musculoskeletal, is extremely easy. Like if you read it and you could picture it, you could picture it. The skin disorders is easy. If you look at it, you picture it, it's easy. What gets hard about the skin disorders though, as well, is the cancers, and it's like different chromosomes and different like things that affects it. So it's not like contact dermatitis where you touch something, oh my god, you have an allergic reaction. It's more so like fibromyalgia. So I'm gonna put the name up. It's like it's somebody would have like, you know how like bumps all over them, like big old lumps all over them. Stuff like that is like a chromosomal disorder, or like, you know, Klinefelter syndrome or Turner syndrome, where that's like more so like a chromosome. So that's the part that gets extremely confusing. So I recommend y'all read that chapter, and then the chapters are confusing too. So watch videos like on each disorder. Watch a video. It might take you 9-10 minutes. It might take you hours, but that is why you in nursing school for, is to watch those videos. The musculoskeletal was extremely easy because it's like it's always in the name. If it's not in the name, you just look at the picture, the disorder, and look up a picture of it. Like for instance, I'm gonna give you a big one: rickets. I'm gonna try to put that right here. Rickets in a child is bow-legged. It's a calcium deficiency and a vitamin, I think, D deficiency. I'm gonna go in detail in the disorders later. I'm just giving you like a summary. So that alone took a while to do. So you have to make sure that you're able to literally picture in your mind on that test, because our test didn't have no pictures. The final exam, which was weird, it had pictures on there, which was weird. But like, you know, rickets is bow-leggedness in a child, and osteomalacia, I'm saying that wrong, is bow-leggedness in the adult. But you have to look at it and see it and know the difference when you have to read it. So that's why the first exam was kind of a lot, because it was 5 different chapters, and it's like you never know what they could pull off of. All the teachers say is read it, and my teacher, I love her as a teacher, but all she do is read off a PowerPoint. I ain't gonna lie, like she just either read off a PowerPoint or did practice questions for the, which I kind of like, because it's more like a refresher in the class. It's not like you're making me learn this stuff. It's like, okay, y'all already read it, so I'm just gonna read, and y'all just gonna go through it. Sorry, y'all. The first exam was good too, because we have 4 weeks. That's a whole entire month to learn all this. But you have to keep in mind too, even though yes, we have patho, and now it's going to be your time consumer, where you're going to stick most of your time in. You do have other 2 classes. I did have physical assessment, and I did have intro. I will talk about those in a different video. But you have to understand, even though physical assessment was the joke class, and intro and nursing aid wasn't as hard as patho, all 3 of those classes, you still had to work. You still had exams. You had quizzes. You still had essays. You still had assignments, and you still had checkoffs. It's like you can't just put all your eggs in patho and then fail the other 2 classes. And that's just crazy if you do, because in my school, I think you only get 2 chances to fail and you out. So it's just one girl, and my friend, she's graduating. That literally, she was at the last quarter. She failed and she got booted out. So they do not care. So that exam, I think an 85 or 86, I believe. It wasn't hard. It was just, I was making stupid mistakes, especially like muscles. Like I was making stupid mistakes. I think I was nervous because that was my first exam, and I'd be having like my bowels be moving, like it'd be loud. I'd be like being a little bit embarrassed, and I'd be trying to rush through stuff. So I think that's what happened, but at least I still passed. So let's move on to exam 2 and what was on exam 2. So let's get into it. So exam 2 was, just to make sure, we had our exam in week 4, and we didn't have a class in week 4, but we still had week 4, 5, and 6 on week 7, second exam, if that makes sense. Meaning our second exam had week 4, 5, and 6 on there. So that's considered the GI system, gastrointestinal, which we're gonna talk about that later. We had the reproductive and the urinary system, which I'm shocking. It is way easier in patho because I swear to God, those was the two of my hardest to learn in anatomy, but it was the opposite in patho. I think those two was the easiest in patho versus me learning this in anatomy because those was hard in anatomy. And then we had week 6 was the endocrine, which that was kind of difficult too in a way. Like I love endocrine system, but in patho it was hard. It was like going way into depth. So what is my recommendations for exam 2? Gastrointestinal. 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 Put all your eggs in the gastrointestinal system. When I tell y'all that shit was hard, like you had esophageal atrasia, which is like when your esophagus doesn't form right, so it kind of like cuts off. So it's like a birth defect. That's why I told y'all, keep that in mind. All the congenital disorders was hard. Congenital means like by birth, like you couldn't control it because you just been birthed. Like it just happened during birth. That's what congenital disorder. That's the main hard thing in patho was congenital. It's like, damn, what the hell? What chromosome? What thing? What was the causes? Big on clinical manifestations. When I tell y'all gastritis, gastroenteritis, and peptic ulcer disease, those was the hardest for me because I knew what they were, but you have to know the clinical manifestations or like what does H. pylori actually affect? Because everybody will be like, oh, H. pylori affects everything. No, it doesn't. It does not affect everything in the gastrointestinal system, and I learned that the hard way. So we have some select all to apply, and I'm just giving y'all a big behind hint. Like literally, know what H. pylori is. H. pylori is a stomach bug. Just think of it as that, like a stomach bug, like an infection that affects most of your stuff that's in your gastrointestinal system. The rest of the stuff, like appendicitis, pancreas and the liver do play a big role, but they don't play a big role in like the disorders in the gastrointestinal. They more so play I thought somebody was behind me. It played more so like a big role in more the endocrine when I talk about more about the endocrine and the blood disorders. So, baby, kudos to y'all. The urinary system, E. coli. I thought you'll think E. coli is more so like a bug for the stomach, but when I tell you E. coli is 100% would be most of your causes for your UTI, most of your causes for your urinary disorders. Literally, if I recommend E. coli is one of the main disorders, like what a glomerulonephritis, not for it. It's just like that's most of the urinary system disorders, like it affects filtration, or let's say for instance, polycystic kidney disease is basically when you have all those bumps on your kidneys, causing your kidneys to like fail, causing a disruption of the RA system. Then you have what else? Hydronephrosis. That's when your I gotta show a picture of that too, where it's like your kidney ducts start to swell, causing like too much pressure to hit your kidney, causing kidney damage. You gotta know the difference between acute kidney and acute kidney disease and chronic kidney disease, because it's two big different things. You have to know that. If you don't know it, you need to go look it up. If you don't look it up and you fail it on the test, then you don't go to Keon and be like, damn, Keon, you ain't say that. I just already told you. It's a lot more disorders, but I'm gonna get into detail on each one when I get there because I have to screenshot it and actually like I'll make a separate video on that, but I'm just giving y'all like an overview because it's a lot. And it's like this is more like a teach back method for me, so that way when I get into MDC, like med surg, I can relearn all this stuff. Because one thing about patho is gonna follow you to the end. Like if you do not know this now, you need to go back. Like during your 2-week breaks that I've been having, I'm gonna give a separate video on that. You need to go back and go review your patho. Every quarter, go review your patho. Go do practice questions, do exams, Do little Quizlets. I don't do Kahoots because Kahoots don't work it for me. I like Quizlet because it's more so it's to the point. I don't like that. You got to wait and then click the time and all that. It's just too distracting for me. So that's what I recommend y'all do, because now this final one is going to get fucking real. Excuse my language, but it's going to get real. So, sorry, I'm getting parched. The final exam was 100 questions. And baby, when I tell you, them first 50 questions was on these 4 systems, and them shit was hard. Neuro, respiratory system, blood disorders, and cardiac. Y'all like, oh my God, ain't the cardiac and blood the same thing? It's the circulatory system, but it's 2 different chapters. One chapter is all about the blood disorders, like the white blood cells, like leukemia, lymphoma, or what else? Sickle cell, all the anemias you have to know. Pernicious anemia, deficiency of B12, sickle cell anemia, when the red blood cells are misshapen, causing them to rupture the others, causing all types of pain, discomfort. Iron deficiency anemia, low iron in your blood. What does iron go on always follow? Oxygen. What happens when oxygen is low? SOB. It's a bunch of disorders that I can name. Sepsis. It's a lot. And the thing that makes it hard about this final chapter is because the nervous system, you'll know like a disease like cerebral palsy. Okay, that's a disorder that kind of like makes you like all your movement to like come contracted, and you have droop face or stroke. But mostly all the brain disorders have something to do with the blood disorder. That's the part that makes it hard. It's a comorbidities, meaning like this is affected from something else, like aneurysm. You can have a brain aneurysm, but an aneurysm is a blood disorder. It's a blood disorder, not a neuro disorder. I know it's weird. It's like different things, and I'm gonna go in detail on that, but I'm just giving y'all like broad examples of it. So that respiratory disorder. Respiratory can be easy and hard. Easy as in like, for instance, atelectasis and versus pneumothorax. We both know that's a collapsed lung, but atelectasis is more so like a controlled collapsed lung versus pneumothorax, when it's mostly from a traumatic injury, like a puncture, versus atelectasis, where it can be caused by one big thing is anesthesia can cause, and that's basically like, and if you can see, I'm gonna show a picture too, like you can see it, like you'll see one side of the lung is just like disappeared while the other one is still there. So that's basically what it, or a fusion where you see like a lung and then you see the other lung, but it's like half of it and the other one is just like white or clear. That's fluid. Or like pleural effusion. It's a bunch of disorders which could seem easy, but then you got one respiratory disorder that you're like, what the hell? I was confused too. Cystic fibrosis. You might be wondering, okay, cystic fibrosis, ain't that like mostly for your urinary area or like your pelvis area? I thought that too, but it's a different name for that. It's you have cysts on other ones, or you have polycystic or cystic fibrosis. Cystic fibrosis is basically a disorder of the mucus secretion in your alveoli and your gastro. So it basically kind of hardens it, causing like a bunch of bunch of chaos in your body, causing that to be a medical emergency. But I'm gonna go into detail in another video because sometimes I just gloss through shit. The blood disorders was pretty easy. They were pretty easy because they more so like hemophilia. It was hard at first until like I had to do I think what made it easier, because even in patho we had assignments, and I think that assignments kind of correlated to like it. Like our teacher would give us like a disorder and she's like, okay, talk about it. And I did hemophilia, and then I had like a couple questions on my exam about hemophilia, and I knew it because I'm like, damn, I did it. I'm the one who researched it, and I'm a big research person, so I'm going to research everything. So that's what I did, and it was easy. Like hemophilia, it's a disorder where it causes you to bleed out. Like if you get like one little cut, you don't have any hemostasis. Hemostasis means that it clots your blood so that way the injury can start forming. But if you don't have your blood clotting, you're just gonna bleed out. That's what hemophilia is. It's like a genetical disorder that affects factor 12. So hemophilia A, von Willenberg's disease, is, it affects, factor 8, which helps assist factor 10 to become factor 10A to blood clot. And then hemophilia B, which is Christmas disease, sounds weird because it's Christmas, but it's a Christmas disease that affects factor 9. So I don't see any difference between the two, but supposedly it's a difference. So that's what I recommend. Yeah. And the cardiac. Y'all, I think that was probably one of the most hardest ones I think was in here. And I think that was the same one for anatomy. The cardiac was hard. When I tell y'all, it's like the cardiac is a lot because it kind of piggybacks on the neural system, and it kind of piggybacks on the blood disorders because it's like you got aneurysm. They talk more in depth with aneurysms in cardiac because the AO, all the valves are so close to the heart, and I guess that kind of make it seem like that affects it. And then also you have shock. Shock is extremely huge in cardiac, and it's extremely huge in the medical field, and it's extremely huge in nursing, like shock. When a patient is shock, they're about to damn near die. Impending doom, just please make sure you save that patient. That's a big chunk of that was talking about that. And then a lot of them was talking about, excuse me. Sorry, I had to come back because I had to remember. Arteriosclerosis, look that up. Look it up, 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 look it up. That was majority of my exam was about arteriosclerosis, but about what it affects. You got to understand, arteriosclerosis is the closing of your arteries. What happens when that starts to happen? You have so many disorders, and one of the main disorders that you would not think that will affect is your heart. Coronary artery disease. What is that? The narrowing of your coronary arteries. And where's your coronary arteries at? On top of your heart. And what happens when you get ischemia, meaning reduced blood flow to the heart and reduced oxygen to the heart? Tissue damage. And what happened with tissue damage in the heart? Myocardial infarction. You're going to have a heart attack. Boom. That's what I'm saying. You will only, that's what it piggyback. That's what's hard about the cardiac disorders is because it piggybacks on additional disorders. So you might have one disorder that affects another disorder, that affects another disorder, that affects another disorder. That's the part of the cardiac system that was hard because it's like, when I was reading about the heart, because I did my assignment on that week on the cardiac disorder. Myocardial infarction, aka heart attack. But then when I was reading the chapter, it was like it is caused by coronary artery disease and it's caused by arteriosclerosis. And I'm like, what the hell? But that was the time where I didn't read the chapter yet, so I had to go flip the pages back and read about coronary artery disease. And I couldn't read coronary artery disease until I read arteriosclerosis. And then when I got read arteriosclerosis, then I'm like, damn. Then I got to read about what causes arteriosclerosis. And it was like a lot. Blood clots could cause it. Thrombus, embolism could cause it. A buildup of fat and cholesterol in your body can cause it. A lot of shit can cause arteriosclerosis, which can cause coronary artery disease, which can also cause a heart attack. Myocardial infarction. Y'all see that was a lot. That was a lot, right? I'm telling y'all, patho is a beast on its own. Like it's a beast on its own. Like I even too, because I said I was gonna help y'all. Like I am also too. So in the future, please look out on my videos. I'm probably gonna do like 1 or 2 a week where I'm gonna go on each. Let me. Sorry. I'm going to go on each module and kind of pick the disorders that we had and I'm gonna just kind of talk a little bit about it. But I'm gonna keep it brief because, baby, one thing for sure, and I am not the smartest kid in the world. I'm not the smartest man in the world. So don't be trying to be like, oh my God, I don't. Google it. Google it, Google it, Google it. My brain is like going like on 100 miles per minute because it's like, you have to understand, it wasn't easy for me. And I think that's what people need to understand, because this is my second go around in nursing school. I went from the LPN program to the RN program. I'm an engineer, couldn't find an engineering job, so I chose to do nursing. And it's hard. It's like, because you got to work and go to school. I understand people have to work. I understand people have kids. I understand people got to do this. But you have to make time for yourself. This is going to be a career. Regardless, it's going to be a career. Nobody want to sit there and be a CNA and wipe ass all the rest of their life. Nobody want to do that stuff. I'm sorry. I am real in my videos. So my tips on passing patho. My number one tip for you, I know this is at the end of the video, but I wanted to kind of explain. My number one tip for you is to read the book. You might not like reading that book. I didn't like reading that book, but the book got me to pass the class with an A, technically a B. But it got me to pass the class. You have to read the book. If you do not understand the stuff, watch a YouTube video. There are billions of videos on YouTube, especially in the medical field, that's going to talk about each disorder, and it's free. You don't have to sit there and go buy all these different things. The only thing I bought for nursing school, and the two things I bought, I did buy some patho flashcards, but that's going to be a whole nother video because I don't think those things help me at all. And I have bought a patho book that was $60. That book ain't helped me at all, but I did buy Quizlet, and Quizlet did help me. So I recommend Quizlet because Quizlet helped me out a lot. That's another thing I recommend. Like Quizlet, I'm gonna put it right here. I think the membership is like $8, and I'm not getting sponsored by them, by the way. And the full year is $35. Just buy the $35 for the full year. You can make your own custom quizzes. You can make your own, like literally anything you need to put on there. Just put your school name and put the class name and put exam 1 or exam 2, and it's gonna be on there. So just letting you know. So that's another thing I recommend is Quizlet. I don't do the Kahoot thing. I don't do no flashcard. But hold on. I'm going to tell you this too. For the exam, in order for you to pass the exam, because our school is considered, even though you'll pass the class, if you do not get a 78 on each exam, you'll fail the class. Or above, you'll fail the class. This might sound crazy, and I did this at first, but I stopped doing it because it was time consuming, but I recommend you do a flashcard. Any flashcards that you see on the chapters that you don't know, like words you don't know, is look it up, because it's like stuff that they'll like put in, like perfusion, perforation, or exudate, like different like lingo that you never heard before. Like they'll start to put that in the exam, and it's like, it was stuff like you'll know, like for instance, you'll know the whole entire, like I read the whole entire book twice, but I still would get stuff wrong because it's like the vocabulary and the terminology that they would use is kind of like, damn, like I had to think twice, you know. So that's what I recommend. I don't want this video to get extremely too long because I'm gonna make like sub videos on, patho. Another tip that I recommend is I do study groups after you study. I think the people problem with my class and why most of them fail is because they're all trying to go on study groups right away and trying to fit in and be friendly with everybody. Me, I study all by myself. I ain't study with nobody. I'm gonna be honest with you. Nobody. I did not study with nobody. Nobody studied with me. I passed, and that's just how I am because I didn't study with nobody. I'm perfectly fine when I'm studying with nobody. I still pass. I don't know. I can't get into that because people always get off topic. People always bragging about their grade. People always bragging about this and that. Nobody wants to stay on what is patho. Everybody want to do something else, and nobody want to talk about it. So that's what I recommend y'all to do. Do not be in them groups. And 3, YouTube is your best friend. Use YouTube for turning all your assignments first. Turning your assignments early so that way you can start studying later. Because when I tell you I'll be procrastinating, I'll be procrastinating. So turning your assignments early so that way you ain't got to wait. You stay ready, you ain't got to get ready. Number 4, During your 2 week break, each our quarters go by quarter, so we'll have a 2 week break. Study. You have to study. Study before, during, and after. You're in school. Until you get out of school, you're not going to stop studying. I don't care. Oh, you have a 2 week break. That 2 week break going by fast. I got 10 more. We got less than 10 more days until my next quarter comes. I have Med Surg, MDC1. I have NCOA, Nurse Care, Older Adult, and I have professional nursing skills in 10 days. And we have a dosage calc exam. Two of them that we have to pass with 100% on the first day of orientation, which is September 30th, which is the first day of school. So that's why I always tell people, you have to study. I don't care. It's not like, oh, I'm going to take me a 2 week break. I'm going to go to Cancun or a trip somewhere, and I'm going to come back and I'm going to be ready. People don't work like that. People don't study last minute. So if you stay ready, you got to get ready. And number 5, I don't know. This is the last one before I end this video, is be yourself. Be yourself. Knowing your limit, levitation. Get you some rest. Take a walk somewhere like I do. I go to the park. I'm always like a shut-in in my room all the time, but it's not like I can't come out and enjoy nature or take a hike or enjoy yourself, because school is stressful. School, it will make you to the point where you depressed and you sad, but I still passed. But I still had a social life. I still be on the phone with my best friend. I still go out and party. I still hang out with my little brothers. I still do. I still play my video game. My video game is my number one cope. I don't smoke or drink, so my video game is like my coping mechanism. You have to do stuff that you love to do. Don't do stuff and then like, oh my God, I just got to study 24/7, because baby, I can't do it. I do like a 30-minute or hour study session, and then I'll take me a 15-minute break. Hour, 15-minute, hour, 15. So boom. Like, comment, subscribe. Please leave the post notification. If y'all want to hear any more things, like I told y'all, more patho stuff coming soon, more other stuff on my channel coming soon. So, just get into it and stay into it. So have a good day.